Hello, everyone. Today we join a good episode and one my true beliefs. It's an episode about apnea. We have two experts with us today, Dr. Montalban and Dr. Nolido. They're going to talk about more in depth what is apnea, what are the symptoms, why should people should care about, and how important it is to know about, and we're going to go in depth detail in all this today. So I hope you all enjoy this episode. So, Dr. Montalban, Dr. Nolido, how are you today?
Hello.
We're
Good.
good.
How are
Thank
you?
you so
Very
much.
good.
Thank you for
Thanks for
having me.
having us here.
It's my pleasure. It's my pleasure. So, if you both catch your eyes, I mean, why are you doing this? Why it's so important to share this knowledge of apnea, and for people to know a bit in more depth, what is actually apnea?
So, sleep apnea is a sleep disorder where your breathing stops and restarts many times throughout the night. There are different types of sleep apnea. There's obstructive sleep apnea, OSA. This particular one is the one that we do treat in our office. And it's basically a blockage of the airway during sleep, which then causes you to wake up uh, and um, and then gasp or grab some air, and it disturbs your sleep really throughout the night. There's the other one, central sleep apnea. It's basically a temporary absence of signals to your intercostal muscles, your diaphragm, that allow you to breathe while you're sleeping. And then there's complex, which is a mixture of both.
So, for people to understand, I mean, we did the resemblance of what is, and there are two options. And why are they? I mean, why are they important for people to understand? When they feel that they might have. I mean, what are the current symptoms that people usually can have when they have it?
Well, the biggest symptom and the biggest indicator that a person might have sleep apnea is snoring. So some people think, oh, I'm just snoring, and oh, my spouse or my bed partner is just complaining, and I've snored all my life. My parents snore. It's not a big deal. It's just annoying. But that's actually could possibly be that sleep apnea, because the reason they're snoring is the tongue is going back to their throat and causing that vibration and causing that noise. So they're not actually breathing as well as they would if they're not snoring. So it's not just about the noise. So, and it's so important because it can cause other things, and people don't even realize it. They just think, oh, I'm just snoring, but that's the biggest sign, you know. So yeah.
And for these signs, what are the possible effects or possible diseases that this can might cause from having, beginning of apnea? Is it related to heart, to lung? What kind of symptoms and diseases can a person have in the future if he start to have apnea?
One of the biggest diseases that can come up is hypertension. Diabetes is also very big. Strokes early in the morning occur more frequently, especially since sleep apnea usually occurs during your REM sleep. And REM sleep, as you go through the night, gets longer throughout the night, and it's at its longest in the early morning. And so when you have a long REM sleep and more incidence of sleep apnea at that time. So those are the three big ones for sure.
There's also heart disease. It can cause heart attacks. You mentioned stroke, diabetes. It puts you at risk for actually reducing your lifespan. And that's why it's so important, and what why people should know about it. So it's not just about snoring. There are, of course, other signs and symptoms, but that's the biggest one. That's the biggest one that should trigger people to say, oh, maybe I have this, but what do I care? Why is it important? And the reason is because, it can actually reduce their longevity, of
Yeah.
life.
Yeah.
So
And of course, this is related to not sleeping well. So the body gets tired, the brain gets tired, and of course, it goes along to other possible diseases in the future. Am I correct?
That's correct. Yes, it actually is more difficult to control your weight when you're sleeping, especially when you're in your deep sleep as opposed to the REM sleep. That is when it's very reparative, and that's when all the important hormones are released. And things like growth hormone is released, being able to control your weight and your appetite is, those hormones are released.
Yeah.
So yes, it is very important.
Um, how can people detect? I mean, this is especially related for people who live alone. I mean, for those are very hard to detect. If you're living with someone, of course, the other person complains. You start having discussion. But what about for the ones who live alone? What kind of symptoms can they feel or detect for them to go to a doctor and getting into deeper research on that?
Right.
the other one, so say they don't know if they snore, but they don't feel like they're getting very restful sleep. They feel overly tired during the day. They're saying, oh, I sleep so much, but I can take a nap anytime. And we're not talking about like siestas or something like
No, of
that.
course. Mhm.
We're talking about waking up after 7 or 8 hours of sleep and still feeling extremely tired, not able to concentrate, just sluggish all throughout the day, and not understanding why that is. So, of course, if people are sleepier during the day, that they have trouble at work, trouble at school, because their brain is actually not functioning. They didn't get the proper oxygen at night for them to function during the day. So they can get into accidents. People are falling asleep when they're driving. So that's very, very much important to know whether or not you're getting that quality sleep. And we're not talking about people who are just sleeping short 3-4 hours. No, they're sleeping the right amount of time, but it's not quality sleep because
Yeah.
they're not getting that oxygen into their bodies because they're snoring, or maybe they're not actually breathing a little bit all throughout the night, so their
Right.
brain is not getting that oxygen, so they become very tired during the day. So if they're living alone, maybe they'll say, I don't know if I snore. Maybe they knew if they snored when they were younger, but maybe there's nobody to tell them. But even if they're getting the proper amount of sleep, what they think is the proper amount of sleep, they're always tired. That might be a clue to ask their doctor, hey, is there something that I can do? I heard about maybe sleep apnea. Is this something that I might have? What do you think that I have? That sort of thing.
And
So,
also,
yeah, please go ahead.
I just want to touch upon mental health. A lot of patients who have sleep apnea will suffer from insomnia, and also mood swings, depression, anxiety. So they go to the doctors to get help for those particular problems, but really the underlying issue is sleep apnea and not getting enough air, not getting enough sleep, not getting enough rest.
I would guess that the person that suffers from apnea also don't have like deep sleep because maybe
Correct.
the person
Correct.
snores, they don't sleep well properly, right? I mean, they don't realize, but of course their sleep does not go
Yes.
deep. So
No.
that makes also a lot of other problems because that moment, even just by the noise itself, they don't actually sleeping when they're supposed to,
Right.
right?
That's correct. Yes. If you look at the cycle of a sleep apnea event, basically you have a patient who's sleeping, and when they turn over onto their back, the muscles that protect the tongue and the tissues in there, they relax. So the tongue and the soft tissues will collapse back. And so what
Right.
happens is the airway gets smaller and smaller, and then eventually it collapses. But as it's getting smaller and smaller, that's the air that's trying to get through. And the snoring that you hear is the tissues are vibrating. But when it
Right.
collapses down, your O2 drops and your CO2 goes up. And so then what happens is you have full collapse, your brain then kicks in and says, hey, arise, arousal, it's time for some arousal. And then what happens is it releases cortisol. So your cortisol goes up, your blood pressure goes up,
Yeah.
your blood sugar goes up. And when that happens, then you have your airway opens up. And once the airway opens up, then you breathe again. And then you get a little break, but then it cycles back over and over. So, yeah. So that's
I
basically.
actually didn't know much about apnea before, our conversation. I went deep through it, and there's some parts, especially from the mental side, that I do understand.
Yes.
And not sleeping also can get a person into paranoia because it needs to have that rest. And
Right.
that goes through anxiety episodes and depressions, etc. So
Correct.
the main objective is for people to understand that if you detect, according what we just discussed, that you feel overtired during the day, that you're not sleeping properly, that you cannot focus because you haven't rest, you want to focus but you can't because you feel too tired, and then suddenly you feel like you want to sleep anytime during the day, you should go and see a doctor. So that's the main objective,
Yes.
for people to think about that and not let it go because it can go worse, of course.
Right.
Yes.
And I know how people usually think. I said, "Oh, this is nothing. I'm made of steel. There's nothing going on. And it will never happen." Well, I always say to people, it will never happen until it happens.
Right.
So just keep all the time that in mind, that no one is invincible, and just watch out for yourself and for any of these symptoms for you to go and look at, which is common sense.
Yes.
People always should care about themselves and take it seriously in this case, because it's not only you. Because if you're driving, you can hurt other people too,
That's right.
because you
That's
didn't want to go to a doctor, right? So
Right.
I just wanted to leave that perspective, in public to make sure that people take this seriously.
Right.
So,
Absolutely.
what else should we look for, that can indicate when a person has apnea? What other problems, apart from the ones we discussed, can go abroad and go worse in some case?
Well, sleep apnea, because it can cause all of those things that we discussed, people don't think that they have it necessarily. Like I said,
Right.
they think it's just snoring. They never tell their doctor about it. Their doctor's not thinking about it. But it's actually, if they have a lot of these other symptoms, if they
Mhm.
have hypertension, diabetes, uh, reflux. A lot of people have reflux. The GERD,
Right.
that's also, these are signs, other signs that they might have it. And they might actually get better if they at least treat the sleep apnea, because the sleep apnea can cause all those things. So now, say we're getting older and they're saying, oh, I'm just getting older. I have this disease, that disease, and I'm taking all this medication. But it's actually the sleep apnea that is contributing to it. So if you treat that cause, you might actually make yourself healthier. So, even if you don't figure it out in the beginning because of the snoring or the tiredness, or you don't have that, but you have all
Right.
these other diseases, you might want to say, maybe there's another factor that I can control to help other than just check it, behavior modification, which behavior modification is also another one, because weight is another big indicator that you might have sleep apnea, and it can cause sleep apnea. So
Okay.
if you lose weight, sometimes that both things get better. Just like when they tell you you have hypertension or diabetes, if you just change your lifestyle, sometimes you can go off of the medications. So same way, it will also help with the apnea. So it's very important to know that if you control that one other factor, and know that that's something that might be contributing to all of these things, maybe you can come off of medications and get healthier. So and instead of taking so many things or having so many problems. So that's why that's also important.
One interesting
Um,
fact.
Sorry.
Oh,
Please
just
go
one
ahead. Go ahead.
interesting fact that when you lose weight, your tongue actually also gets smaller. So
Okay.
interestingly enough, sometimes it helps, you know, decrease the incidence of sleep apnea because then there's more room for the air to get in. So that's just one interesting fact.
There
So
is.
I guess when something touch the hormones, I guess it touch everything in the body. So I guess that's all the beginning of the catastrophe. Let's just say of how it start. Am I correct?
Yes, I was going to say there is one other potential consequence of sleep apnea that people don't really talk about. And yes, we're women, but it is worth mentioning here. It
Sure.
also can cause erectile dysfunction, and
Okay.
for a lot of men, most of the people that have it, 2 times more men have it than women.
Right.
So if it's causing erectile dysfunction, they might say, and they're snoring, that
Yeah.
might spur them on to think maybe this is a possible cause. So from a male perspective, that might be something to think about and make it important for them, to know whether or not they have sleep apnea. I know it's a little funny, but it's still a
No, no.
very
I mean,
concept.
it is what it is. I mean, people should know what are all the symptoms, and it is what it is. I guess it's so in the end, it's so connected to what we've been discussing. I mean, when you touch the testosterone of a man, of course, it changes everything. So when you go very low on hormones, you have the effects on in general. I mean, you
Right.
have effects on the mood, the way you're doing things, the strength, the
Correct.
you don't have the same, I would say, the same atmosphere of being lively because you can't. You can hardly think, I would say,
Right.
and that in the end affects everything. It can affect a person socially. It can affect
Right.
a relationship. All this from one start.
Yeah.
Just because people sometimes think, oh, it's nothing. Well, there we go. From nothing you get a chaos. So
Yes. Just interestingly enough, just from the snoring,
yeah,
studies show that 25% of couples don't even sleep in the same room anymore, just because of the
amazing. I didn't
snoring.
know that.
Yeah, so there are, certain decibels. So some patients have really very high decibels, and, the partner just really can't tolerate or can't sleep themselves. So they end up
Right.
separating, sleeping in separate rooms just
And
from
and
the snoring.
what do you think when this happens? Why the person that snores wouldn't go on a checkup? I mean, there's already a big reason to go. Why would you think that most people don't do it?
I think, oh, did you want to say something? Okay. I feel for my patients when I speak to them and I talk over like the symptoms and what I see and things like that. A lot of them kind of feel, they say they're okay. And it's because I think they feel like it's their normal. It's like, I've always been like this. I've always only had 3 hours of sleep. This is just how I am. And it's their normal. So for them, there's nothing to fix. but we really try to let them know what these are your symptoms along with what we're seeing. But it's some patients are like, this is just me. But we do have patients will say, hey, my partner does snore, however.
Amazing.
So, yes.
I mean, what would it take for people to realize that should actually see a doctor and start a treatment? I mean, obviously, some people mentally, I don't know. I mean, it's hardly for me to put on that position because I'm not like that. But thinking as which, what would it take for people just to change their minds and they realize they have a problem and it needed treatment and right away, you know?
I think that's part of what we're trying to do as dentists, and that's why we're talking to you, because you might say, oh, why is a dentist talking to us about sleep apnea? What do they care about that? Why? Like, they're not a medical doctor that can know about these things, but actually there are signs that we look for, anatomical signs,
Yeah.
because it's not just about the snoring. There are factors that we look for, like neck circumference, if they have a big neck, if they
Right.
have a big tongue. If we look, so we do these screenings as part of our examinations. And if we can't see into the back of their throat when they stick out their tongue, then that could mean that the tongue is too big or the throat is too small. And if
Right.
that's happening, then they might not be getting enough air in there. So those things might spur them to think. So that's why we talk to our patients about that, because exactly like Dr. Nolido said, there's a certain stigma. There's a certain stigma in saying that they have another disease. Nobody wants to have these diseases. Sleep apnea. I don't want to, I heard about that before. I don't want to know that I have that. I don't have that. I just snore, because people don't want to admit that there's something wrong with them.
Yeah.
But what they need to understand is, number one, it's very, very common. Most people don't even know that they have it. It affects so many people. It affects millions of people. And there shouldn't be a stigma about it. But sometimes it takes something like this, a podcast, or somebody like a dentist, or because sometimes people don't go to their doctors as much as unless they have something wrong with them.
Yeah.
For them to maybe seek some help to even think about it. I would say that when we do these screenings, the patients, like Dr. Nolido said, are like, oh, there's nothing wrong with me. But when we say, but we see this, your palate is kind of narrow, or your jaw is narrow, you can't see into the back of your throat, your tongue is a little bit big, the weight is also a factor, the neck is a factor, all those things. But even if they're skinny, maybe their anatomy just makes them still susceptible to it. So it doesn't only affect overweight people.
Yeah. No.
Yes, I feel in terms of screening, I think we as dentists are in the forefront for sure. It's actually very exciting for us to be in this position, and to actually be able to help patients as well is very, very exciting for us. But in terms of screening, in addition to the large tongue, a lot of times we'll see a crease right in the middle of the tongue, and also we'll see a lot of scalloping on the sides of the tongue also.
Okay.
And then yes, and then a lot of patients also will have malocclusion, right? So if you have malocclusion, that means maybe you have a crossbite in the back where your upper teeth are on the inside and your lower teeth are on the outside, or in the front where your front teeth are in the back. That also decreases the amount of space that your tongue has. So that also will, affect you in terms of sleep apnea. Other things that people don't know is that when you're grinding and clenching, that is also a sign of sleep apnea. When you're not getting air, it's a natural reflex protection from the body to try to open up the airway, and that's just to do that you clench and grind. And a lot of patients who come in here into our practice who clench and grind, we see a lot of broken teeth, we see a lot of broken fillings, and crowns. and they're in pain, they're sensitive to cold, things like that. So we try to let them know that it's not just clenching and grinding. It can be potentially sleep apnea as well when they have the other factors along with the clenching and the grinding. And then if you go for a testing, and I know this is for next time, but if you actually go to a lab for testing, they also test for not only bruxing in your mouth, but also bruxing of your limbs, your arms and your legs.
Okay.
So it's very exciting for us to be able to help with not diagnosis, but at least screening. Mm-hmm.
Wonderful, wonderful. So there you have it. I mean, all the relative to know how important it is to find out if you have apnea, and how can it be bad to yourself and to anyone out there, and the amount of problems that you can search for yourself for not looking into it. It's something serious. If you feel any of the symptoms, you should go to a doctor. You should tell what you're feeling and what you're not feeling. I mean, why you feel so tired, whatever, and
Exactly.
look into it. It's not a matter of let's be tough and hang it anyhow. No, I mean, you have a responsibility also, and if you have it, and if you're driving, for example, you can hurt other people, you can provoke an
It's
accident.
true.
Even at work, depending on kind of work you do, you can provoke an accident and hurt someone else. So it's a
Yeah.
matter of an act of responsibility. People should be responsible by themselves
Right.
and think that in common sense, it's a normal thing. You have something, you need a treatment, you need to go to a doctor. And that it is.
Yeah.
And there's nothing to be afraid of. It's not like they're going to do some kind of weird treatment, because I mean, I'm talking like this because I really know how people think usually. I mean,
Right.
everyone, if you do like a normal survey to everyone, said, you like to go to a doctor? I mean, you can
Yeah.
ask 1,000 people, they all say no. I mean,
Right.
but
Right.
it's necessary. It's not a matter of why should you be afraid to go to a doctor if you feel something and
Right.
not go and research and get a treatment on it.
Yeah.
You'll feel better after, for sure. I mean, it's
Right.
not a matter of putting yourself, you're not going to put yourself in danger. You're going to treat something that you're going to make your life easier for future and even for your own society. I mean, even for yourself, if you have a relationship, your family, because if you are in the bad mood, no one can stand you. I mean, people need to evaluate themselves and see what's the reaction, right? I mean,
Yes.
if you're talking to 10 people and that 10 people say they cannot stand you, there's something wrong with you. You should think that,
Right.
no, I mean, there's nothing wrong with me. It's the other people, right?
Right. Just
Absolutely right.
just going back to driving sleepy many years ago, maybe about 15 years ago. I was driving on the highway, and a woman drove by, and I just happened to look over, and she was driving, but she was asleep
Right.
driving.
Amazing.
It was really scary to see, for sure. I didn't know how to alert her, but that's how she was driving. So
I
it's
would guess. I
yeah.
mean, asking to you, I would guess that if you suffer of apnea in the very high stages already, you can provoke sleep forcefully in any time during the day, like if you seated or you just fall asleep just like that, right?
Right.
That
Yeah.
is that's what we were talking about with the excessive daytime sleepiness, and exactly like what you said, you do have a responsibility to other drivers if you are always tired, if you operate heavy machinery. You don't ever want to endanger yourself or your coworkers, people who are doing that kind of work. It also affects cognitive functioning. So
Yeah.
that's how their brain works. If they're foggy, they're foggy because
Right.
they're not getting enough sleep. It's the same thing. Even if they're not, they say, "Oh, I'm not falling asleep," but maybe they can't think. They can't
Right.
Of course.
think clearly, you
Yeah.
know.
Yeah.
And like you said too, irritability. When you don't get enough sleep, there's more irritability. So, like you said, uh, you ruin the relationships around you, all because of this. And you know, it's one small factor that people have to realize could affect so many things in their lives. So let's not even say their health. You know, the all of the things that we said, the hypertension, the diabetes, the heart disease, all of those things. Yes, that's all the medical things. But even on a social level, you know, how they interact with people, how they're working, their weight, their mental health. There's so many things that are affected by it. So that's why it's so important to know that it's not just snoring, you know.
And I would guess also. I mean, if you're doing like a technical work on a computer, for example, in an office, it's going to be impossible to work. I mean, how you cannot
Yes.
possibly
The
think
blue
and
light.
doing something
Yes.
is your brain cannot produce even a conversation for 2 minutes, right? So
Right. Right. Or
another reason for you to see that you're not functioning properly in
mm,
anyhow. It's not
that's true.
about losing productivity. I know this happens, especially in the financial world. There's a lot of stress, pressure.
Right.
People running is need the number. But people in between. I speak now with people, with extreme stress. Sometimes they don't figure out what's actually wrong with them
Hmm.
because they have extreme stress and pressure on them, and they don't want to handle properly. So they misfigure that situation is actually getting worse because of one thing that they are not seeing. So
Yeah.
I'm just putting the advice out there because I do have a lot of knowledge in financial
Hmm.
world, and I know how people usually work. It's like coming out, eating fast food, 15 minutes, going up again to office,
Right.
no
Right.
drinking, getting on a Thursday out, going to nightclubs, drinking. It's all part of the panorama in this, and it's not. It shouldn't be. And
Yeah.
there's a lot of things that people really should look at, and
Right.
that's not a proper routine. I know most people doing it like that, but it shouldn't be.
Hmm.
It shouldn't be. Firstly, you should have a healthy diet. That's one of the most important things that most people don't have because they don't care. Because they care about other things, but they misfocus. One important subject, which is diet. The diet actually is the
Right.
essential source of resolving many other health diseases
Right.
because people don't do it. If you eat fast food, I'm putting this now because I actually made an experiment myself
Oh.
on my own free will. I actually ate for 30 days fast food for 30 days to prove people with blood analysis that this is bad.
Hmm.
I wanted to prove people that this is really bad. So
Yeah.
what happened? Well, what happened is that the cholesterol went up 80%. So you
Wow.
know, and,
Hmm.
and and I went to the show physically, and then after that, of course, I started to go to the gym, clean myself up, etc. But
Right.
it's really bad. I mean, you
Right.
can have fast food maybe once a month or something
Right.
like that, but you shouldn't have
Right.
it as a routine.
Yes.
It creates, I mean, cholesterol is one of the biggest sources
Yes. Yeah.
of disease
Hmm.
and a lot of diseases that it can create after, especially heart diseases, then brain diseases, and then you start breathing diseases and many other things. So in the end, I mean, it's people look after themselves. I mean,
Right.
that's my message out there is that
Definitely.
you have a responsibility with yourself. Treat yourself good. You only are in a journey here. You're gonna be just one time here. Why make it so bad to yourself? You know,
That's
right?
right. That's
So
correct.
treat yourself good.
Yes.
Eat properly.
Only
Have
one body. That's
yeah,
all you get. Treat it
absolutely.
well, for sure.
You touched on something else about how you treat yourself and things like that. People treat themselves. One of the other things that also affects sleep apnea, or if people are snoring and potentially have it, is actually alcohol and drug use as
Yeah,
well,
yeah,
Yeah.
especially all kinds of drug use. But even now, as you know, here in the United States, marijuana is becoming more and more legalized in many states, but also alcohol. People always think, oh, I need to drink something maybe to fall asleep, right? Or if they have to take a sleeping pill or something like that. That's actually counterintuitive to the
Yes.
sleep apnea. It's actually making it worse.
Yeah.
So it is very important that people also realize that that's another factor that
Yes.
might make it worse, because their body then, alcohol is a depressant. A lot of these drugs that make you sleepy are depressants.
yeah.
Marijuana and also like the sleeping pills. So that actually causes more of a relaxation of the airway, and it makes the sleep apnea worse.
That's
So
right.
that's also very important for people to realize, that if they think, oh, I just want to sleep, I just want to have a good sleep, let me have a scotch, or like a glass of wine,
Yeah,
or take something because I'm not sleeping well, because I'm always tired, but I wake up so much during the night. That's another
Mhm.
sign. If they're waking up a lot during the night, they have a restless sleep. That could be because they have sleep apnea. Meanwhile, they're doing something that's making it worse. So
that's
that's
right.
also an important factor for people to consider, that they shouldn't be relying on those things, like I said, like alcohol and sleeping aids and other drugs
Yeah.
to help them sleep, because it could actually make the sleep apnea worse.
Just going off of that, actually, also antidepressants do the same thing as well. Just touching up on the cognitive decline, also, eventually that sets you up for dementia as you get older
Yeah,
as well. So,
and of course you got also some addiction if you take it for very length of time, right?
right. Hmm.
And that's not good either.
Right.
So it's the matter that drugs or pills are not sweet. You shouldn't just take it just because you want to, or forever. You
Right.
need to
Right.
do things and think for yourself and in common sense and act in common sense to
Yes.
make better. And then of course pills help. But I mean, it's the concept. I mean, most people think that no, I just take these pills and they'll fix everything. No, it's not just that. I mean, pills help, but you need to help yourself doing what we just discussed. I mean, you need to have a healthy routine. You're supposed to be healthy. If you can do exercise, it's even better because you make you feel better. And
Yeah.
and of course, during the night, you probably sleep better if you have this
Right.
healthy routine,
It's,
and all these things that you should care about. It's not about, no,
yeah.
I drink alcohol, I smoke marijuana, so I take this pill for this, I take this pill for that. No, it's not like that. Because in the end, you might get a cirrhosis, or you might get a heart stroke, or you get,
Right.
lung dysfunction, or your kidneys start not
That's
functioning properly
correct.
because you wake up during the night because the kidneys don't rest. So you feel
Right.
all that anxiety, and of course going so often to the restroom because you're
Yeah.
not sleeping, right? And you're draining yourself because all your liquids are not filtering properly because you are overdrained. So
Yes.
just everyone to take that all that in mind, to see this is not like we're not trying to dramatize it. This is the reality. And
Yeah.
it's just a
Yeah.
simple thing. Just go to a doctor, check up yourself, and see what's wrong with you. That's all it is, right?
Yeah, what you just said also about going to the bathroom, that's actually another indicator that you have sleep apnea. Because those centers, when you're in your deep sleep or your REM sleep,
Yeah.
they're not awake, right? So if you need to go to the bathroom, that means part of that brain has woken up and you're not sleeping appropriately. And
I know all this
yeah,
because unfortunately the person passed away for other reasons. But a friend of mine back then had apnea. So I just didn't know what it was. I mean, I didn't saw a lot of relevance back then. But I knew that he was sleeping with an oxygen bottle during the night and everything.
Right.
And that's how I found out the symptoms, because he told me most of the times that he was going to the bathroom a
Right.
lot during the night. Um,
Right. Yeah.
he couldn't sleep properly. To sleep, you need to put in the almost in a upward position to breathe
Correct.
properly. Things like this. So I knew a bit about that, but I mean, I never really went deeper, because I mean, my life was
Right.
very fast, and I couldn't listen to everyone like properly. So
Right.
it was also a problem
Sorry.
of mine back then.
Sorry about
I
that.
was traveling a lot, and when people were talking to me, I could only listen 10 minutes, because that's all I had. Uh,
Right.
a
Oh.
person came to me and said, "I have 10 minutes only. That's all it is." So I mean, it created sometimes a forced conversation and people not opening up, and it
No.
was hard. But I
Mm.
wanted to expose that is wrong too. And I learned that myself, that you should rule your routine, not the routine ruling you. So
Right.
have that in mind. I let that go for many years, and we came to a point that literally my work was controlling me 100%.
Right.
Literally, because I was going through a calendar, and my life was the calendar. I said, "Well, I mean, how did I got to this? I mean, I was literally a calendar." And said, "Oh, my God, can I go for a coffee? Can I go?"
Yeah.
You know, it
Yes.
was like that. So,
We're on a
so
hamster wheel.
yeah,
Yeah.
exactly. So
Hmm.
it's not about that. I mean,
Yeah.
I have a thing that is not 8 or 80. It's something in between. It has to be something in common sense. It's not
Balance.
all work, and it's not all party.
Yes.
In between.
Yes.
So
Mhm.
common sense, and that's what people should look for. And
Absolutely.
yeah.
Yeah. Yeah. So, what? Yeah, with your friend, how he propped himself up while he was sleeping. A lot of patients do that. Well, they'll prop themselves up, or sleep on the side, or sleep on their stomach to try to just get that air in and out. And also, just touching upon like
Yeah.
medication. A lot of patients will take melatonin, thinking that they'll improve their sleep, but what it really does, it helps you go to sleep, but it doesn't keep you there. It doesn't keep you, asleep. Your sleep apnea, if you turn over and the tongue collapses back, oh,
Yeah.
the cycle starts all over again, wakes you up again. So, yeah.
And during this, and according to the symptoms, are many specific treatments depending what the stages of the patient is detected, or it's the same treatment just in length, or how does it work?
Well, we start off with, for treatment, we start off with diagnosis, and we can't do that. We actually we have a sleep team that we work with, and we have a company that is able to send the home sleep study over to the patient at home. So they do
Okay.
2 nights, and then part of the sleep team is a physician who'll read the sleep study for us and make a diagnosis off of that.
And how usually is the diagnosis of a person that has already severe stages of apnea?
Do you want to?
So, like she was saying, there's really only one way to really diagnose sleep apnea, and
Okay.
it's to get tested. So there's a few ways to get tested. The more traditional way to get tested was a going to a sleep clinic. So years ago, you have to go to a sleep clinic, and they hook you up to all of these machines to test your blood oxygen levels, the breathing. There's somebody there, but that's such a difficult thing for people to do. They don't want to go there. They're not really sleeping because
Yes.
somebody's watching them. They're in a laboratory. They're not comfortable. So that's that was the traditional way of doing it,
Right.
polysomnogram. So, and somebody's watching them the whole night. Nowadays, we do, like Dr. Nolido was saying, we do have these home sleep test kits that have to be prescribed by a doctor or even us as a dentist. We prescribe this, and then the company will send it, and then you can follow the directions. A patient follows the directions
Correct.
and puts this on their head and sleeps with it for one night, 2 nights,
Right.
or so. So that way it'll grab some data, and then they send it back to the lab, to the team, to interpret the results there, and that will monitor their breathing, it monitors their blood oxygen, it monitors their heart rate. So those are the three biggest things that it's going to monitor. It'll also monitor the loudness of their snoring. So a lot of these things nowadays, the technology is so good that you can do it at home. So really, there's no reason why someone who might even suspect that they have sleep apnea can't do it. There's no excuse, because you don't have to go somewhere else. You do have to talk to a doctor. You can't just order these things online or something
Yeah.
like that.
Right.
Somebody has to interpret it. But, it's like, it's still something that you can do quickly at home, so that you'll get the answers, rather than saying, oh, I don't have time for that. Oh, I don't want to go sleep somewhere else, But that was how it was for a very, very long time, probably up to, 10 years ago or something like that. Because I know 20 years ago, that's what you had to do. You had to go to a sleep clinic in order to get diagnosed.
And yeah, go ahead. Go ahead.
Just having said that, if we do have patients who have, say, epilepsy or have had several cardiovascular events already,
Yeah.
or if we suspect right off the bat that they're severe, the lab test is really the best for them. But for the most part, if we suspect mild, moderate, and that's what we can treat, we do send the home sleep study. And it's important when they're doing the home sleep study to do more than just one day, because the way you sleep every night is different. So
Right.
at least 2 to 3 nights should be done in terms of the home sleep study.
How do usually people react when they are diagnosed of apnea? I mean, what is the first behavior of the person usually when they said, well, you have apnea, and this is, your routine, your treatment to start treating it? How do usually people react?
Well, I would say that first we have to talk to them. This goes back to the screening. First, we have to talk to them and make them understand why it's so important. Because if they don't understand the importance of the diagnosis, they're not even going to do the test. So we go through that whole thing, like what we just talked about all this time, why it's so important to get tested. So once they're tested, it's like any other disease. Of course, they don't want to have it, but they recognize that if they have it, okay, then they want to treat it. So they're, especially if they're going to get tested for it, those patients are more, they're more motivated to treat something like that because they want to be healthier. Sometimes they get a little bit afraid, like, oh, am I going to die? I had a patient that said to me, oh, am I going to die? So, sleep apnea is one of those things that you're not just going to die immediately. And a lot of our patients are in their, middle age or even younger. I mean, when it's really going to be more important is how it affects your whole overall well-being. So you're not going to die from one sleep apnea event. So sometimes they get a little afraid that, oh my gosh, I'm not breathing all night, and this is horrible. Treat me for this. But I reassure them that even though it's not going to kill them, it's still very, very important. And what will affect them really is how it affects all of these other body systems, how it affects their lives socially, how it affects everything else, all the other medical conditions that it can cause. That's really what it's about. So that's why they should think that it's important to treat it. But as far as their reaction to it, I would say sometimes they're a little bit in denial, but usually by the time they take the test, they're ready to accept, whatever the test says, because now
Right.
they're interested. Now they know it's important.
Sure, sure, sure. So, I mean, so there you have it. I mean, you have no excuse to not go to a doctor and not do your testing, and
Intelligence, yeah.
yeah, yeah,
Yeah. Yeah, a lot of patients, the limiting factor is really they think they have to go to a sleep lab, and that's really not the case anymore for most patients. It's very easy. It's a little digital monitor you put on your forehead, 2 cannulas, sleep for 2 nights, 3 nights. Basically, that's it. Making sure you start on your back,
Yeah.
get a good reading. So yeah, it's a lot easier these days.
and from this, I mean, of course, we're gonna discuss this on next episode, but just to do a short intro. Um, are there, I mean, there's specific data out there. I mean, when we research, there's over 900 million people supposedly affected of apnea worldwide. And most of them, which is an amazing thing when I read it, is they don't know they have it. This is something that can go to any age, right? I mean,
Yes.
you can, yeah,
Ah, interesting. Yes. No, children should. We also make sure to screen children as well. A lot of children who maybe are not doing well in school, maybe they have ADHD. Definitely a sleep screen should be part of the full treatment. So yes, a lot of our patients have large tonsils. If you have large tonsils and you lie back, tongue collapses back a little bit, that also hinders the amount of air you get. So a lot of these children
right.
are going to school sleepy, cognitive, decline. They can't pay attention in school. Their grades aren't going, very good. So yeah, definitely to children as well.
That's
So,
that's actually a very important point. Pediatric sleep apnea. Children should not be snoring. So sometimes parents will come to us and say, "Oh, they snore," and they think, "Oh, well, I snore, so they snore," and they think it's nothing. Actually,
So,
children should never be snoring. There's usually so for parents, this is very important for them to know that pediatric sleep apnea is very important because that's when their brains are growing and they're growing the most when they're sleeping. So if they're not getting the proper oxygen when they're sleeping, then their brains are not going to develop the way that they should. I mean, it's already bad enough for adults who have it, who will end up with all these problems. But I think that it also contributes to a lot of these mental problems that we're seeing nowadays and these cognitive issues that these kids are having if they have these apnea, if that's a factor. That's not always a factor, but it could be a factor, and it could be a factor that can be removed. So for those, for sure, those we don't treat, but it's very important to see that. We'll also screen them in the same way. We'll look at their airway. We'll look at their tonsils. We'll look at and see whether or not we can see in there. Because a lot of times now the ENTs and the pediatricians say, "Oh, their tonsils are big. They don't want to take them out or anything like that." But if the child is not sleeping, this
right,
is very, very important for their brain development. So meanwhile, sometimes the doctors are just worried about putting them under an invasive surgery to remove the tonsils. So children have some different treatments there. We don't really touch on that, but we do screen for it so that we can alert the parents that this might be an issue. I did have an incident years ago, probably 20 years ago. She's the mother now, but my ex-husband's daughter had very large tonsils. Her airway was very, very small. She was
Right.
7 years old, and she had dark circles under her eyes. And I said to my sister-in-law at the time, I said, "What did your pediatrician say about this?" And she said, "They all said, oh, she just has large tonsils. It's not a big deal. She'll outgrow it. It's fine." I said, "Does she snore?" And she said, "Yes, she snores." And I said, "She has these dark circles under her eyes. Does she sleep well?" "Oh, she sleeps, but she snores a lot." And I said, "You really need to see a pediatric ENT." So I referred them to a pediatric ENT because, again, this was 20 years ago. So I wasn't even that involved. And I
Right.
remember her coming back to me and saying that they took out her tonsils or adenoids, that they were much larger than what they thought. And that the pediatric ENT said to her, "What made you?" She had really, really bad sleep apnea. He said she was at high risk for that. It was much worse. "What made you come here?" She said, "My sister-in-law is a dentist." And she said, yeah, she couldn't see her throat. How is she breathing? And he said, "That was a good call." So really, dentists are the first people. She had pediatricians, at least 3 pediatricians, because they moved around a lot, tell her, "This is nothing. We're
Right.
not going to treat it. We're not going to do anything about it because she'll outgrow it. It'll be fine." So now that little girl is in her 30s, and she has children of her own, and she's very healthy, and she's very smart. So I was very happy that I was able to catch that. And that's where it's important for us as dentists to look for these things also, and to inform our patients, because it really does affect them. And sometimes they're not even going to hear that from their other doctors. I'm not saying that the other doctors aren't good, but they're looking at other things sometimes.
Yeah. 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 So I think you have all the important points that people should look at. We talked about why they are important, how does it affect you and your people close by, what kind of problems we will have in the future, and of course the nature of being social. Because if you are
Right.
very irritated, you cannot stand anyone, or people cannot stand you because you won't be able to have a conversation. So it affects everything. It's
It
something for people.
does. Yes, it really does.
And in this way, we're trying to make sense of people to have self-responsibility and have common sense. And if they have these symptoms, please go to check yourself. And it's
Yes.
not only about you; it's about making your life easier. You will feel better with yourself. People around you will feel better also, because you'll be a better person, a better version of yourself, and
Right.
looking good to yourself. In the end, that's all it is. I'm saying it like this because people, like I said, they are like kind of, "Oh, I don't want to go to hospital. I don't want to go to doctor. I don't want to." No, I mean, it's not about. There's nothing wrong with that. If you have something that needs treatment, of course you need to go.
Yeah. Prevention.
Exactly. Exactly.
Mhm.
Exactly.
Balance
So,
prevention.
of course, of course. So, regarding all this, what other stages or what other possibilities that we haven't discussed yet would you like to expose?
Well, I think for my patients, I tell all my patients in terms of health and how they should hold their lips and their tongue and their mouth. I
Right.
tell my patients healthy living is lips sealed, breathe through your nose. Your tongue should be resting at the roof of your mouth, and your teeth should not be touching. That's kind of like this, but that is healthy living. And I try to tell all my patients that.
Wonderful, wonderful. So that was all, folks. We discussed, very important subjects today. I hope it was very helpful. Definitely very insightful, informative for anyone out there.
Yeah.
So whenever you look this, if you have symptoms, just go check up yourself. Think about the others close to you. Think about yourself, because you're definitely gonna live longer if you take a treatment and you get diagnosed. To start something to be a better version of yourself. Let's just say,
That's correct.
and for sure you'll feel better after that. I'm pretty sure that if you are into a treatment to get into a good stage, in due time you will start feeling better with yourself. I mean, you start feeling that you sleep better, that you rest better. Things
Yes.
are starting to get with evolution at work, or with your relationship or with your family. There's a lot into it, so don't mess up with that, and just have common sense and look into it. So, what other advice would you give for today?
Well,
My
uh,
biggest advice would be go to your dentist. Make sure you get your teeth checked. There's all other things that can go wrong if you don't
yeah,
get your
Right.
teeth checked, but
yeah,
some dentists can also screen you for sleep apnea. So, you don't have to think that it's just the medical doctors who are going to be the ones to are looking out for your health, you know.
yes. It's
Absolutely.
yeah, just it's easily detected, it's easily screened, it's easily tested and treatable, and it's life changing. So,
Absolutely. So, with all that, we leave it all for today. Don't miss out on May 28th, part two. We're going to
too.
discuss the other segment, what is the current treatments, the machines they've been using. We're going to talk about what kind of stands are we using to detect that, and what is the mainframe resolution to see the light. So basically, that's all for part two. Don't miss out. Hope you enjoyed for today, and see you all next time. Thank you all for today. Thank
Thank you
Hi.
you.
for having us.
Thank
Bye
you
bye.
so much for
Thank
having
you
us,
so
Julio.
much.
Take care.
Thank you.
All
Thank you.
right. Bye bye now.